Something peculiar is going on with the coronavirus as there are new such symptoms arising in this global pandemic that has been caused, and as it spreads around the world, doctors are beginning to scope the coronavirus damage seen initially as a cause of viral pneumonia during the chaos of explosion of cases in China. It's now emerging as an enigmatic pathogen capable of harming the body in a myriad of unexpected and sometimes lethal ways. Clinical manifestations range from common cold-like symptoms and bronchitis to more severe diseases such as pneumonia, severe acute respiratory distress syndrome, multi-organ failure, and even death. The illness may occur as a direct result of viral infection as well as the body's response to it. As the doctors keep discovering new ways the coronavirus attacks the body, it can damage the kidneys, heart, brain, even COVID prompts reassessments of the disease and how to treat it. Deborah Coughlin was neither short of breath nor coughing in the first days after she became infected by the novel coronavirus. Her fever never spiked above 100 degrees. It was vomiting and diarrhea that brought her to the Hartford Con emergency room on May 1. You would have thought it was stomach virus, said her daughter, Katharina Coleman. As the daughter, Katharina Coleman, she was talking and wearing and completely coherent, but even as Coughlin, now 67, chatted with her daughters on her cell phone, the oxygen level in her blood dropped so low that most patients would be near death. She is on a ventilator and in critical condition at St. Francis Hospital, and one more patient with a strange constellation of symptoms that physicians are racing to recognize, explain, and treat. At the beginning, we didn't even know we are dealing, said Valentin Foster, physician in chief at Mount Sinai Hospital in New York City and the epicenter of the US outbreak. We are seeing patients dying in front of us. It was all of a sudden you are in a different ball game and you don't know why. Today there is a widespread recognition the novel coronavirus is far more unpredictable than a simple respiratory virus. Often it attacks the lungs, but it can also strike anywhere from brain to the toes. Many doctors are focused on treating the inflammatory reactions it triggers and its capacity to cause blood clots even as they struggle to help patients breathe. Learning about a new disease on the fly with more than 78,000 US deaths attributed to the pandemic, they have little solid research to the guide. The World Health Organization's database already lists more than 14,600 papers on COVID 19. Even the world's premier public health agencies, including the Center for Disease Control and Prevention, have constantly altered their advice to keep pace with the new developments. Actually, we don't know why there are so many diseases presentations. A virologist said at the Center for the Infection and Immunity, Columbia University, her name was Angela Rasmussen. Even the 4 months of clinical experience across Asia, Europe, and North America has shown more pathogens, much more than invade the lungs. No one is expecting a disease that would not fit the pattern of pneumonia and respiratory illness. And it was being said by David Reich, a cardiac anesthesiologist, and president of Mount Sinai Hospital in New York City. It attacks the heart, weakening its muscles and disrupting its critical rhythm. It savages kidneys so badly some hospitals have run short of dialysis equipment. It crawls along the nervous system, destroying taste and smell, and occasionally reaching the brain. It creates blood clots that can kill with sudden efficiency and inflames body vessels throughout the body. It can begin with a few symptoms or none at all. 10 days later, squeeze the air out of the lungs without warning. It picks on the elderly people weakened by previous disease and disproportionately the obese. It harms men more than women. But there are also signs it complicates pregnancies. So, guys, please be very careful, and you always know that I'm continuously saying to my in my channel that please take a preventive measure and always be alert and always be careful when you go outside and take a preventive measure most of the time when you're doing shopping or anything else. And this virus will never go out of our system, and it will stay for as long as the human society lives. So you have to be more careful. The only way to eradicate this virus is to create a vaccine, and many people are working on it, and see what happens. So I'll catch you on the next one, and okay, be safe and have a great day. Goodbye.